Thank you so very much, Sharon. I really appreciate that. And yes, I will say I'm very excited about working with people with arthritis based on this information. And chances are those of you that are on the call are either dealing with it yourself or have patients or clients that you're working with that have it as well. So I think you'll find this information really interesting. So I'm going to go ahead and start. So the most common types of arthritis are osteoarthritis, rheumatoid arthritis, and septic or inflammatory arthritis, with gout being the most common sort of inflammatory arthritis. And it's defined as inflammation of a joint, which is accompanied by pain, swelling, stiffness. I would also say like lack of motion would also be one of the symptoms as well. So we're going to talk about joints. We have 300 joints in our body, and our joints consist of cartilage, ligaments, tendons, and remember those three because those are going to be important when we talk about nutritional protocol. And then synovial fluid. And I'm going to start with talking about synovial fluid first, because this is really important. Synovial fluid is a shock absorber to our joints. It supplies nutrients. It removes waste from our joints, which is important as well, very important, and allows for smooth movement. Even our ears can be damaged by arthritis. And again, I've learned so much about new ways of looking at arthritis based on this clinical research that I've done. So we have tiny joints in between our bones inside of our ear, and they can also suffer from inflammation. And this inflammation comes from antibodies or antigens that can create nodules. They're known as rheumatoid arthritis nodules that actually develop inside of our ears and interfere with our hearing. And these antibody deposits on the hair cells of the inner ear can also destroy these cells. And then we also have vasculitis, which is inflammation of the blood vessels, which causes or damages our body's ability to send out auditory nerve and brain. So start thinking about any ear issues as a potential type of arthritis as well. And what's really interesting is the medications that are typically used to treat arthritis. And medications can be the salicylates, non-steroidal anti-inflammatories, anti-rheumatic drugs, and one that's not on here are anti-malarial drugs will also affect hearing. So our current understanding of what causes arthritis is trauma, degenerative changes. So doctors will tell you, well, sorry, you're just getting older. There's nothing you can do about it. And metabolic disturbances such as diabetes can certainly be a contributing factor to arthritis. Here's the new perspective. Another way of looking at arthritis, and please start thinking about this with all achy, pain-related issues, including arthritis, is that all forms of arthritis are infectious or may be infectious in nature. And so it's not just relegated to gout. This is any arthritis. And think of arthritis as either being in the acute or chronic stage of infectious arthritis. Okay, so we talked about the joints and we talked about synovial fluid as being part of arthritis, but our synovial fluid will actually change. It can become thick and it can actually start destroying the joints and even tissues of the body. And we'll talk about that in more detail too. And it causes the changes that cause this to happen in our synovial fluid are bacteria, viruses, fungus, and other organisms also known as stealth pathogens. staph infection, strep, and I thought this was interesting too. Tuberculosis is linked to parasites. Parasites are linked to arthritis. And sexually transmitted disease, I would say at least 90% of American women have been diagnosed with HPV. But that was amazing. Again, this is going to be a very important question to ask anyone who has or is suffering from arthritis. Tell me about your infections from childhood on. Very, very important. So here it mentions these sexually transmitted diseases are tied not only to arthritis and rheumatoid arthritis, but also multiple sclerosis. Here's the American Society for Microbiology produced a paper on the progression of staph infection and found that within 24 hours of being injected with staph, our synovial fluid started to thicken. Not a good sign. And then within 72 hours, we had the beginning of rapid joint destruction. So not good. And it mentions here extra articular manifestation, especially signs of bone infection were also found soon after inoculation of the bacteria. So extra articular manifestations mean outside of the joint. Urinary tract infections are linked, and pneumonia are linked with gout. Bacterial pneumonia is linked to rheumatoid arthritis. And other forms of strep include encephalitis and impetigo are also related to inflammatory arthritis and rheumatoid arthritis. But again, I'm asking you to start looking at strep related to any form of arthritis. And again, we talked about sexually transmitted diseases, and this is all clinically backed that most sexually transmitted diseases can cause arthritis. Other potential causes of infectious arthritis are insect bites, fleas. Okay, so this was interesting. Fleas, ticks, mosquitoes are linked to arthritis. Animal-borne diseases. So whether or not you've been diagnosed with parvo, toxoplasmosis, or psittacosis from dogs, cats, or birds, please keep that in mind. If you've got someone with arthritis, especially if it doesn't seem to heal, ask them about their pets, ask them about insect bites, and very important, ask them about any kind of periodontal issues or infected teeth. Here's a very interesting study. So the Case Western Reserve University is considered one of the top private universities in our nation. And they did a study with 36 patients with knee arthritis and found that 5 out of 36 of these had gum bacteria in their synovial fluid, not supposed to be there. And that in 2 of the patients, the mouth and the synovial fluid bacteria were identical. And their summary was that it is well known that advanced periodontitis can lead to harmful bacteria entering the bloodstream. Once it gets in, it can go anywhere. The target is often a site of existing inflammation, such as the arteries, that's scary, or in this case, the knee. So I'm hoping that you're seeing that I'm establishing a foundation as to why it's important to get a history of all infections from childhood on when you're dealing with someone with arthritis or any health issue for that matter. So here we go. This infected synovial fluid negatively impacts the joints, bones, and soft tissue. Okay, that's really scary. So it's gone beyond the joints. We talked about the extra articular manifestations. Well, here we go. Bones and soft tissue. Our soft tissue, just so you know, it can be either fat, muscle, fibrous tissue, but our soft tissue is also part of our lymph system. Again, very scary. So our lymph vessels are affected. They're a part of soft tissue. And our nerves. So our soft tissue also surrounds or supports our internal organs. So when you have bacteria in your synovial fluid, if it affects or starts to degrade your soft tissue, you're affecting your other organs. And in some of the most severe cases, this infection can also cause a loss of blood supply and lead to bone cell death. Not good either. Because our blood carries essential nutrients and oxygen to the bones. And when this blood supply is disrupted, the tissue, the bones start to break down. It's known as necrosis, and the bones will eventually weaken and collapse. And that causes joint collapse as well. So again, all of that's going to be a very painful situation. And this is really important to see too, how important blood circulation is in arthritis. So we've talked about a new perspective at looking at arthritis. Let's talk about nutritional care with a new perspective. And I think this is really important, again, to first of all, make sure that you're addressing infection. It doesn't matter how many years old it is, it's known as subclinical infection. It still remains in the body, or it can remain in the body. So the products that I'm going to talk about, Standard Process and MediHerb, here are the functions that you can expect. That all the products I'm mentioning are considered very safe. They have, very little reaction with medications, and they're going to accomplish far more than just helping with arthritis. And again, they support all types of arthritis, including infective arthritis. So these are the products that I'm going to discuss. Artemisinin Complex by MediHerb, which now we have a lot of immune products that you can use, and that's fine. If you get nothing out of this webinar today, I'm going to ask that you make sure with any arthritis protocol that you add some kind of immune support. The reason why I chose Artemisinin Complex, and again, I learned this just as a result of doing all of this extra research on arthritis. Artemisinin Complex is support for all viruses, especially important these days, bacteria, fungus, and parasites. So you see, it's really addressing so many of the causes of infectious arthritis already. Standard Process Beta-Col, very important for liver support, and liver and arthritis are very closely linked together, especially fatty liver. It inhibits the it inhibits collagen necrosis, which means it stops the death of our collagen, and collagen is very important. That's one of our friends. We'll talk about collagen later on too. MediHerb Boswellia Complex reduces fibrin and fibrinogen. Very, very important when you're dealing with arthritis. Just so you know what that means, fibrin is important because it helps whenever you get a cut. It helps with the clotting factor. But when it comes to arthritis, this actually leads to more degradation of the synovial fluid. So you do not want that. It's excess fibrin and fibrinogen, and Boswellia Complex will actually help that. It also removes uric acid, and it's anti-inflammatory. Calcifood wafer contains and is very important for our cartilage, discs, tendons, and ligaments. And then any of our fish oils are going to be very important as a fat. They're going to be very, very important to take for arthritis because it lubricates the joint, but also very synergistic with Boswellia. And what makes MediHerb products stand out apart from other herbal companies? A couple of things. One, it's considered one of the safest brands that you can use because MediHerb goes above and beyond what most companies would ever do. They use cold extraction from ethanol alcohol. Most herbal companies, if they've got an extract, are using methanol, which is not the same as ethanol. Methanol has toxic residues, and acetate does too. Acetate is actually considered flammable. So unless you are using a company that is checking for toxic residues, you're not guaranteed of safety. And then in addition, MediHerb is using all of the phytochemicals as per clinical research. Very important that you're getting the active ingredients in clinical studies that actually work. So artemisinin complex, there are clinical studies regarding, so again, here I'm talking about it's not only going to help with your arthritis, these products are going to help with everything else as well. So here we go. Lyme disease, cervical dysplasia and cancer, hepatitis, lupus, MS, and collagen-induced arthritis and rheumatoid arthritis. So some basics about this product is that artemisinin reduces inflammation and activates the immune response. Very important to get that, white blood cells killing whatever it is that's hurting us. And in that process, you could end up with a Herx reaction. And that's where sarsaparilla actually helps get rid of metabolic waste and detoxifies, and it helps prevent a Herx reaction, which is important. So you're killing and you're moving out, which is so important. What I want to say is, you see sweet wormwood, do not confuse this with wormwood complex. Wormwood complex does not contain artemisinin and will not have the same effects. And I will tell you from personal experience, I've tried both. And wormwood complex for me personally didn't do anything because it doesn't contain the artemisinin, whereas the artemisinin complex does contain artemisinin. Now, what's interesting in clinical studies, what makes this special, the artemisinin has a chemical in it, and I don't mean chemical, I mean a compound, excuse me. It's called sesquiterpene lactone, and I'll explain what that is for. So sesquiterpene lactone is an anti-inflammatory, analgesic, anti-tumor, anti-parasite, and antimicrobial, reduces pain and inflammation in a model of acute gout arthritis in mice. And in traditional Chinese medicine, sweet wormwood or artemisinin would support this activity. Very important for healthy blood and skin, and its bitterness clears heat. Again, remember that the infection targets sites of inflammation in the body. It is known as a depurative herb too, and a depurative means purifying or detoxifying the body, and that's the sarsaparilla. So it's an excellent example of a depurative herb used in traditional Chinese medicine, but also very popular in Western herbal tradition, with particular activity toward the skin and joints. So you see the little 9 and 10 as references. And what I want to do is share how you can find those clinical studies. So a lot of the clinical studies that I'm sharing with you today, I found on my own. But this particular clinical study actually came from the Standard Process website. And what you do is, all you need to do is log into standardprocess.com, and there'll be a search box that shows up once you log in, and just type in artemisinin. And this is for any of our products. Just make sure you scroll down past the photo that showed there. And what you'll see below it, you'll see complementary educational tools. You can click on any of those. Those are links that you can either download and email to patients for support. You can also order some of those in hard copy. Usually they'll tell you on the website whether it's digital only or not. So that's a really important piece from the Standard Process website that's going to be really helpful for you. And here's where that particular study came from. More clinical studies. So these are the clinical studies that have all been done by myself. So here is, and then another thing that I found, remember that drugs, a lot of our drugs come from about 25% of herbs. They're only choosing herbs that by themselves are working really well. They've already produced drugs that are made from artemisinin. So here's a collagen-induced arthritis study. This is a drug or an artemisinin derivative, and they're saying that it could dramatically prevent or treat arthritis. And it was manifested by significantly reduced incident joint synovial injury and inflammatory factor secretion. In addition, oral treatment of artemisinin skewed the T cell subset from the pathogenic Th17 to protective Th2 subset. Very, very important. And that it helps increase white blood cells to fight infections by attacking bacteria, viruses, and germs that invade the body. Breakdown of T and B cells. Again, we're talking about breakdown of white blood cells. Very, very important as for fighting off infection. So the breakdown of these induces joint pathology. Again, showing the connection between infection and a weakened immune system and our joint health or joint pathology. Given the well-studied disease mechanisms and clearly defined roles of various immune cells, a recent study demonstrated that artemisinin analog remarkably ameliorated arthritis in mice. And that's why I chose this particular product. And so remember that artemisinin was discovered and won a Nobel Prize for the treatment of malaria. And they found that malaria patients actually were remarkable. Adding artemisinin to the drugs that were commonly used for treating malaria dramatically increased the symptoms in 6 days. And I think that's amazing. So here it mentions specifically regarding arthritis, how important it was for reducing joint inflammation and improvement in functional parameters, including stair climbing ability, motility, and suppression of mechanical allodynia. Okay, allodynia is things that normally would never cause pain, such as brushing your hair or touching your skin, and there's pain all the time. So an example is someone who has a migraine. If they ever say, my hair hurts, chances are that's a form of allodynia or a form of arthritis. I thought that was fascinating too. So if you're ever dealing with someone who has pain where they shouldn't have, think again of allodynia and infectious arthritis, and think of artemisinin complex. In additional animal studies, artemisinin showed promising effects on human rheumatoid arthritis. Again, this is going to be for any type of arthritis, but it's going to inhibit the interleukin that degrades our joints. And even in high doses, so now we're talking about safety, even in high doses prescribed, artemisinin and its derivatives are considered quite safe. There are no serious adverse events or significant toxicity reported in clinical trials. Of course, if you're allergic to artemisinin species, so that's why I put wormwood, mugwort, tarragon, those are the most common, and chances are you'll already know that. If you're allergic, obviously you shouldn't take it. Here's a MediHerb label that shows the artemisinin you are getting. Now see, this is interesting too. Look at how it says Artemisia annua herb 8.0 G. That means 8 grams or 8,000 milligrams. It takes that much to get 40 milligrams. It's teeny, teeny, tiny amount of artemisinin compared to 8 grams. So MediHerb uses enormous amounts of sweet wormwood in order to collect 40 milligrams of artemisinin. And that's what you always want to look for. And again, the sarsaparilla is used as a depurative to, after the killing effect, to get it out of the body. It's very common for people to have subclinical infections for years. And please keep in mind that just killing it is not enough. You've got to get it out of the body. And that's why the sarsaparilla or anything that's going to help move it out of the body is going to be important. Purification. The suggested use on the bottle, it says 1 tablet 3 to 6 times daily. I'm going to give you a different amount. I'm going to say amounts needed will increase depending on the severity of the case. So based on the clinical studies, the equivalent of 16 tablets a day are going to be used for rheumatoid arthritis. As far as gout, I don't know. I'd probably start with 6. And I will tell you that I'm actually taking artemisinin complex since I've done all this research, and I'm actually taking 6 a day. I want to keep not only my joints healthy, but I want to keep my immune system fighting strong, especially during this particular winter. Beta-col is the next product that I'm going to talk about, and I'm just going to break it down slightly for you. Spanish moss is in a lot of our products. And in this particular case, and you know, we think of it, it's an excellent source of naturally occurring vitamin E. But traditionally it's brewed as a tea for arthritis and rheumatism. Interesting. Beetroot. Beetroot is going to be very important for our liver and our gallbladder. Remember, the liver is also involved with arthritis, especially fatty liver. And beetroot serves as an antioxidant and reduces local inflammation. And there's plenty more research that I've done just on beetroot because that's also in a lot of our products. Bovine liver protomorphogen is important for fat metabolism. And what's interesting now is they're linking a lot of arthritis to fatty liver disease. So please keep that in mind. And then organic raw sugarcane inhibits collagen necrosis or helps stop collagen death. Very, very important. And then adrenal cytosol is going to be important for chronic inflammation. Also really important for phase 3 adrenal exhaustion, which again, the body tends to be very cold in that period. It's really hard in phase 3 adrenal exhaustion. It's really hard to get over infection and inflammation. And adrenal cytosol, again, is going to be very supportive of phase 3 adrenal exhaustion. Here's an online review that I found. I thought this was cute. Great product for arthritis. Beta-col was recommended by a friend for arthritis. I purchased it, and within a month, the arthritis in my foot and knee was much better. After 3 months, I hardly noticed any arthritic pain at all. I can't believe that she's only taking 1 capsule per day. Again, my recommendation would be more. I'd probably start with 6, a day of the Beta-col. Boswellia complex. So what I did, and this is really important to look at a label. Don't look at the right side of the label, look at the left side of the label. And on the label, you'll see the boswellic acids. And again, this is important because MediHerb is breaking down the active components of the herb that are proven in clinical studies. And this has 180 milligrams of boswellic acid that comes from 1.9 grams or 1900 milligrams of boswellia. So again, you see that it takes, 10, 20 times as much of the herb just to be able to get the critical components. It has 1 gram of celery seed extract. And again, we talked about fibrin. The phthalides and the coumarins are going to help break down that fibrin or fibrinogen. Very important with arthritis. And then the gingiber officinale is, again, this is an active ingredient that's found in ginger, very important for blood flow, and it's been used for hundreds of years for all types of arthritis. And the curcuminoids found in turmeric, again, that's the full phytochemical beauty of having a really good quality turmeric. Some of the benefits in turmeric's benefits are innumerable, but in this particular case, we're talking about arthritis, and it does contain all the benefits of non-steroidal anti-inflammatories without any side effects. In Ayurvedic medicine, and also known to Westerners, it's known as frankincense, and we all remember its appearance in the story of the birth of Christ. It is considered the oily part of the plant. In regards to the story of the birth of Christ and the wise men bringing it, it was symbolizing the bringing of warmth into the depths of the cold winter. And when you think about it that way, aren't we doing the same thing with cold, painful, stiff joints? We're actually driving out the cold and replacing them with the feeling of warmth, movement, and flexibility, and also circulation, which is so important with arthritis. So we talked a little bit about the celery seed in the Boswellia complex. And what I do want to say is, yes, it is available in liquid. Some people have a difficult time with it because it has a very strong taste of celery. You can already take it in. It is in the Boswellia complex. But what I wanted to share with you is that in traditional Chinese medicine, the seeds are considered the energy pack for the kidneys of the plant. They give you extra vitality. And again, you never want to confuse them with less effective dried celery seeds. You need the essential oils of the celery seed, and you're going to get that from the extract. And I thought this was a cool way of looking at Boswellia complex and why the turmeric is put together with the Boswellia, because they work on complementary mechanisms or pathways. Their curcumin inhibits COX-2, which is the same pathway that ibuprofen inhibits, whereas Boswellia is LOX5 inhibitor. So they have a complementary mechanism of action. And if you use them together, it has a better effect than using either one or them apart. So we're approaching arthritis from different angles that way with the two together. I had another doctor, I'm not going to state the name, but it's a very well-known professional line, but he wanted me to compare the MediHerb Boswellia complex to the particular line that he was carrying. And this is what I found. At the same price per tablet, MediHerb Boswellia complex contains 10 times the amount of boswellic acids, 10 times the amount of the turmeric curcuminoids, and twice as much ginger. And then it has the celery seed, whereas the other professional product contains none. And it was the same price per tablet. So you do the math and figure out which one you'd rather go with. This is one that Zara Bagdasarian, I thought this was a wonderful success story that she shared. She said that I had one patient in constant severe pain and had to use 60 to 70 milligrams of OxyContin just to manage her daily activities. As you may know, it's become one of the nation's most abused drugs, linked more to 100 fatal overdoses in the country. I initially began with a protocol of Boswellia complex and Salagesic. After only 2 months, she was able to reduce her medication down to 1/7 of the dose. So I want you to know that everything that I'm recommending works really well and works quickly. This is a study, again, that if you type in Boswellia complex in your search box on standardprocess.com, this will be additional research that you can click on. And again, you can download and send it to patients, where it's showing there were 22 practitioners and 62 patients that engaged in this study. And they found that just taking Boswellia, not any of the other products we were talking about, that within, I think it was a 4-week period of time, was a 25% reduction of symptoms. So it's important, but again, just adding those other pieces is going to make a huge difference in really helping with arthritis. But I wanted you to, again, I just wanted to emphasize the importance of going further and looking at those clinical studies. Calcifood wafers and powder. I never thought of calcifood, and again, until I did this research, I always thought, oh, it's fantastic for broken bones. It's worked better for broken bones than anything I've ever seen. But it turns out that calcifood is going to be really important for osteoporosis, as I'll show you in another study that's available on standardprocess.com, but also important for arthritis. And it's made from the spines and ribs of raw veal bone. And actually, I think if any of you saw my video, I give my kitty raw chicken neck to keep her teeth strong. One of my friends told me, who raises purebreds, that if you want to avoid ghastly dental bills, feed your cat, or I was going to say kitten, raw bone. Very, very important. So I'm going to break down calcifood powder or wafers. You can choose whichever one you want, and explain why it's so important. It's a source of chondroitin sulfate, raw bone protein, bone marrow, collagen, and gelatin. It's considered, think of it as a bone broth in a tablet or powder form. We all know how important bone broth is to our immune system, and here you go. That's why I'm taking 6 calcifood wafers every day. It mentions here raw bone protein is invaluable support for proper functioning of the joints, a necessary ingredient for building new tissues and muscle structures. Again, if any of them have been broken down by infectious arthritis, we want to rebuild them, and calcifood is going to help. And high quality protein is a constituent of synovial fluid. Again, very important. So let's talk about chondroitin sulfate a little bit more. It's a component found in connective tissues, including cartilage, bone, skin, ligaments, and tendons. And osteoarthritis is characterized by a progressive metabolic change in all of these. And it is a glycosaminoglycan, which is responsible for many of the important properties of collagen, such as resistance and, cartilage, such as resistance and elasticity. And it's an anti-inflammatory effect. Collagen, also all naturally occurring in raw bone, and calcifood is raw bone, is the main connective tissue protein that provides the right cushioning and elasticity to the joints. Collagen forms the structure of tendons, ligaments, joints, and discs. Indispensable bone building ingredient. So here we go. We're talking about calcifood wafers or powder. It is a source of rare amino acids consisting of 50% protein and 50% minerals. The calcifood powder is high in amino acids, which are lost in cooking, and that's why you do not want to use cooked bones. Very important to get the raw bone. Supports protein metabolism and immune system response function, as well as skeletal and muscular and cellular health. Also supports healthy protein metabolism and contains the essential amino acid lysine needed for proper collagen formation. Again, all of these are parts of joints as well. Again, bone protein has to be raw. You cannot confuse it with bone meal products. They do not work. They are steamed. They are considered dead. You're just adding bad calcium to your body, and you do not want to do that. And here's why, too. Remember that bad calcium, has a tendency to accumulate in soft tissues where it doesn't belong. Bone spurs, calcium deposits, those are coming from bad calcium or calcium we cannot digest. This is a study, again, if you type in calcifood on standardprocess.com, you'll find this study if you just keep scrolling down, and this is showing how important it was in a 3-month study, how it decreased osteoporosis by 18%, and that's just the beginning. And Prima. So fish oil is important because it helps lubricate our joints. Okay, so it's going to be very good. And taken with Boswellia complex, it's going to provide that fat, which is synergistic, and it actually makes Boswellia work better. Enhances circulation, reduces inflammation, and please remember the difference, the outstanding factor between standard process and a lot of other professional lines that are out there. Ours is considered very clean. We're using vacuum distillation, which is no heat, versus micro distillation, which is what most other companies use, which is very high heat. And you end up steam distilling all of the bad stuff out of it, but the good stuff too. You end up destroying the essential vitamin A and D profile when you're using a micro distillation fish line. Excuse me. This I wanted to give a shout out. I think it's a great little book. Pam Levin, who's a registered nurse I worked with for many, many years. She's written a book called Arthritis, How to Conquer It. Check these out for top causes. You can look, you go to Amazon and you click on that look inside, listen at the top. You can actually look through her book and decide whether or not you want to read it. I really love all of Pam's books. A few extra pieces I want to mention to you besides a nutritional aspect, the importance of compression socks, because what happens with low barometric pressure, if someone says, well, I'm feeling my arthritis has gotten a lot worse since the weather has changed. The reason why is as barometric pressure drops, our tissues expand, and it allows, when our tissues expand, we have more pressure on our joints, which causes pain. And what these compression socks do is they apply mild pressure, which keeps the swelling down. And compression socks are really cool now because they've gotten quite beautiful, if you want to use that, because I've used compression socks too. Athletes use them. So they're not the old lady looking compression socks of 20, 30 years ago. They're very nice. And they do keep the swelling down, which is important. Obviously, diet is going to be important. These are inflammatory foods to avoid. And that is all that I have.